what use is the Beighton scale?
It's a screening, and it's part of the diagnostic criteria, part of the diagnostic tool set. And it was designed initially for adults. So in 2021, I think there was another modified version of it that was designed for children from the age of 5, which I'll
when do you stop being
to.
a child then?
18, roughly.
Okay.
Yeah. So
there's got to be some crossover, hasn't there?
absolutely, yeah.
Nobody suddenly switches at 18.
I mean, all children really, by definition, are hypermobile in the first decade. They should be, and then they gradually become less so during the teenage years. But some people remain as hypermobile all through their lives. You can score 9 out of 9 on the Beighton scale when you're 10, and then perhaps 4 when you're my age, 57. But the good thing about the new criteria is that it also counts what you scored in the past, not just what you score presently, because we know that things can change with time. We become more stiff with age, but we're still more flexible than most people.
Right, and does that increasing stiffness with age, does that cause a reduction in symptoms of any sort?
On the contrary, in my case, certainly. I find that I get more pain the older I get. Yeah. Whether it's a combination of just age and wear and tear, and having been a chiropractor for 30 years has definitely taken its toll on my joints, I can tell that. But
yeah, but I mean, who are the worst affected then? I mean, it's not just chiropractors, osteopaths, physios who use their hands. Actually, physios, poor things, don't get to use their hands much these days, do they? There must be other professions.
Yeah, anyone who does manual labor. Yeah, very much so. But we see it in all professions.
I suppose then it's fortunate that a lot of most manual labour is done by men, because most of it involves.
And they're not as badly affected by it.
Yeah, and they're not so badly affected. I was going to say it's because men are a lot stronger and less clever.
No, I didn't say that, Stephen.
I could say it. I could agree with that. So we've been asked to run through the Beighton scoring, and we're going to run through that in a little while. But before we do that, I still want to just get to the bottom of the Beighton scale. You said it's a screening tool, so okay, fine, it's a screening tool. At the point where I meet the threshold, then what happens?
Well, then you look at the other criteria. So you look at, do they have the comorbidities? Do they have things like headaches? Do they have things like irritable bowel syndrome? Do they have heart issues? Do they have chronic pain? Do they have recurrent dislocations or subluxations, or chronic repeated sprains and strains and soft tissue issues? And dental problems, dental anomalies are quite common. So such as you often have a narrow narrow palate with crowded teeth. Mm-hmm. But you may also have actual dentine issues or nerves that sit crooked, So you look at that as well. You look at, are they symptomatic? They must have pain in more than, I think it's 3 sites for more than a year in order to qualify. So there's actually something called the GP EDS toolkit that you can go in and download from the EDS website, where you can see all the different criteria.
Are these things that you would screen for in your own clinic, or are you going to say, Beighton, you've passed the threshold, we're going to send you off to someone who can look at this? And
the problem is there isn't many places you can send them. Right. The GPs don't really understand it particularly well. The rheumatology clinic, which is where you would normally be sent, don't want to know because they can't do anything about it. So what I tend to do is run through the GP toolkit and tick off, and if you have enough ticks, then I'll write to the GP and say, I think this person should be screened by either a rheumatologist or perhaps genetics if I suspect there's something, or if I want to rule out things like vascular EDS.